Hi, everyone, and welcome to MGFA's Wellness Series webinar, MG Spotlight on Positivity and Perseverance. My name is Jenna Mbalo, and I'll be moderating today's session. Before we get started, I just wanted to let you know that this webinar will be recorded. If you have any questions, please feel free to post them in the Q&A box located at the bottom of the Zoom menu bar, and we'll answer them during the Q&A segment. I wanted to give a special thank you to our sponsors, Alexion Argenx, Janssen, and UCB. And now it's my pleasure to introduce you to today's presenter, Becky Shields. Becky, thanks so much for joining us. I'll hand it over to you.
Okay, thank you, Jenna. Okay, hi everyone. Thank you so much for being here. I'm so happy to be here and thankful to the MGFA for allowing me this opportunity to speak to you all and lead this month's wellness webinar, especially knowing that this month is Myasthenia Gravis Awareness Month. Today, I want to explore the topic of the power of positivity and perseverance through sharing my story and what I've learned along the way. Hopefully, what you take away from this presentation is how you too can live the life you want despite having myasthenia gravis. And if you are a caregiver, a supporter of an MG warrior, or you're here just to learn about the realities of MG or how to implement more positivity into your life, I hope you take something valuable away too. So a little introduction as to who I am. My name is Becky and I'm 22 years old. I was diagnosed with MG in September 2013 at the age of 14. So I've been living with MG for almost 8 years now. I'm also a student and I'm currently finishing my undergraduate degree in medical sciences, and I'll be graduating in October. I was also accepted to naturopathic medical school and I will be starting my 4-year doctorate in September 2022. My diagnosis, like most of you watching, was hard to come by, and it took a year to receive my diagnosis. I like to show this picture because this is where I believe it all began. This was grade 8, routine picture day, except I noticed that one of my eyes seemed to be lazy. Being a 13-year-old girl, this small what seemed like an imperfection made me insecure. I remember bringing it to my mom's attention and she didn't think anything of it. But you know when you have that gut feeling that something is off? I had that, and a year later, I would realize it was for good reason and that this would not be a one-time occurrence. There was many doctors and specialists that were part of my diagnosis story, and as each new symptom developed, another healthcare professional seemed to be added to the mix. A lazy eye was my first symptom, and not long after that, I started to experience double vision. This was becoming frequent, so I went to a new eye doctor who gave me glasses with prism. I became dependent on the glasses to prevent double vision. She referred me to an ophthalmologist to make sure that nothing was going on with my eyes. I then began to experience the symptoms that included trouble smiling, trouble chewing and swallowing, and trouble speaking. I went to my family doctor when I was having trouble with my speech, and she gave me nasal spray, which obviously didn't work. I went to the dentist who gave me a mouth guard because he thought the reason I could be having trouble with my smile and my chewing could be because I was grinding my teeth during the night in my sleep. When I started having leg weakness and arm weakness, I went to see a pediatrician who was stumped by my symptoms. He thought it could be Bell's palsy with the droop in my face, but it didn't explain the other weakness in the rest of my body. He thought it could be MS, but he said it was rare for someone my age, and I didn't show all the symptoms. He ultimately referred me to a neurologist, but the earliest appointment was many months away. I remember when developing symptoms, no one believed me. It was very isolating, and the stress of not knowing what was going on inside my body was scary. When I developed difficulty smiling, I had multiple people commenting and asking, why was I so sad all the time when I wasn't? And I couldn't give them an explanation other than I physically could not smile. When my voice started to give out, it was around the time of my grade 8 graduation, where I was supposed to give my valedictorian speech. People thought it was because I was nervous. I distinctly remember right before my speech being in the bathroom using my nasal spray and shoving pieces of tissue up my nose, praying that I would be able to get through my speech. No matter how hard I tried, my voice gave out halfway through and no one could understand me. I felt humiliated and I wanted to scream, there's something wrong with me, but what was it? I think the turning point was when I developed the symptoms of difficulty with chewing, swallowing, and the weakness in my arms and legs. When I first began experiencing weakness in my limbs, I remember asking my grandmother on our walk home from school if she could go get the car. At the time, she laughed, and because I was very into the subject of drama, she thought I was being overdramatic. But when it began so that I sat around all summer and was still exhausted at the end of the day, my family knew something was wrong. Here in the middle is when I was having difficulty chewing. As you can notice, the amount of effort it is taking to chew one single bite. I remember some nights feeling so frustrated that I didn't eat my whole meal, and some nights I would choke and it would scare me from eating anymore. My mom took videos of these symptoms because whenever I went to the doctor, it didn't seem like I had the same issues. Little did I know that these symptoms were known to fluctuate. As my symptoms began to worsen, I was starting high school, a very transitional period in a young person's life. I had gym as my first period, and it was so hard to articulate to the teacher why I couldn't do certain things. She was very understanding, and I'm grateful, especially when I didn't have a name to what was happening to me. I also started falling at my locker at school, and I would come home every day so exhausted. I was supposed to see a neurologist in November 2013, but one night in September was the turning point that made us decide that I could wait no longer. I couldn't get up off the toilet by myself. This was a pretty upsetting moment. Something was overtaking my body so much that I was no longer independent. This is when my mom took me to Sick Kids. So I'm not really sure what I was expecting, but what I was not expecting was having to stay at Sick Kids as an inpatient. When we arrived in the ER of Sick Kids, which if you're not familiar is a very well-known hospital for children in Toronto, after telling them the history and being assessed, MG was one of the 3 possible diagnoses that they came up with. When they brought me up to one of the inpatient floors, I felt a heavy sense of imposter syndrome. I didn't feel like I looked sick enough to be here. I was worried that they weren't going to believe me and that I wouldn't get a diagnosis. And I looked around at all the other kids with tubes and IVs and felt like I didn't belong there. The past year, I had been made to feel like my symptoms were not valid. So this was where the most action had been taken, and a name of a disease was presented that fit the profile of my sporadic symptoms, finally. My fear subsided over the next few days, and I started to get some answers. I was finally diagnosed with MG, and I was given medication to start. So I want to just say that I love Sick Kids. It's an amazing hospital, and I'm so grateful to my whole healthcare team there, and thankful to my mom for making the decision to go to Sick Kids. These 2 people in this picture were major players in my story. Dr. Beiser on the left is one of the sweetest and most genuine people, as well as doctors, and in the middle is his nurse, Lynn, who is also amazing at what she does, and I still keep in contact with her to this day. The doctors, especially at Sick Kids, I found spoke to me and not just my mom. In the past with my family doctor, I felt like I was overlooked and that I was made to feel like I wasn't capable of understanding what was going on. Doctors like Dr. Beiser talked to me and made sure that I was well informed and valued my input on how I was being treated. And I continue to advocate through the adult system that my input matters. So I think there's a misconception that once a patient has a diagnosis that the mystery is solved and on to the next, case closed. What I don't think a lot of people understand is that patients of chronic illnesses like MG take an adjustment period, and within this period, they have to change things in their life in order to conform with their new normal. For one, I had to focus on developing positive and supportive relationships. That meant surrounding myself with people who are willing to listen, accept me for my limitations, and care for my well-being. Unfortunately, not everyone can be positive additions to life, and I learned this reality when I was bullied. I was bullied by a girl in my grade, all because I looked at her funny one time, and she did not know that I was having weakness in my face, and she came to the conclusion that I didn't like her. This experience taught me that it is so important to not judge someone by one encounter, because you never know what they're dealing with. I also had to adjust my extracurricular activities. In the later years of elementary school, I played basketball, volleyball, and soccer. With my leg weakness, I wasn't able to do these things, and it was so disappointing for me that I couldn't try out for my high school team. I turned to drama, and again, I was in 3 shows, 2 musicals, a play at school. My drama teacher was amazing and adapted some of the dancing and scenes that I was in to ensure that I had ample time to rest in between. I also had to learn to pace myself in saying this and conserve my energy as much as I could. I did this by resting whenever I was starting to feel tired and taking elevators instead of the stairs. I also had to understand my limitations and really listen to my body when it had enough. I had to learn to advocate for myself. In the beginning, this was really hard because I was embarrassed and I didn't want to have to deal with people's judgments or have to tell them the whole story. I learned though that this is very important, and standing up for myself in and outside the healthcare setting was key. For example, having to remind people at my high school that I'm allowed to take the elevator when I would get comments like, "I don't see a broken leg." Or in the healthcare setting, persisting for more tests when some doctors conclude that there's nothing wrong, when I feel in my body that there's something different. I'm going to dive deeper into this later on in the presentation because I think this is so important and a huge component of leading a quality life with MG. I also had to find support through other patients who had MG. I was feeling very alone with my diagnosis when I was initially diagnosed, and I had attended a support group meeting, but all the patients were above 50 and could not relate to what was going on in my life. My mom ended up finding some people my age to talk to online. I have to date connected with people in Canada, the US, the UK, Germany, and Italy. Now, coping with my diagnosis, I will have to admit, was one of the hardest factors of my adjustment. I became depressed and it was difficult for me at the time to think positive or be hopeful. I went and saw a counselor, which did seem to help, but trust me when I say it was a difficult period and took a lot of work. I encourage you, if you are at this stage, please reach out for help. There's no shame and there are a ton of resources out there. I know I use these resources also even now. Lastly, I had to learn how to ask for help. I was a pretty independent person before my diagnosis, so the idea of asking people for help with what seemed like small tasks was hard for me. I was in denial that I needed assistance, and I had the misconception that if I could do something on my own, that I didn't need help. But when doing said task made me feel weak after completing, I soon had to realize that it wasn't worth that much energy and that I had people in my corner who wanted to help me. As we all know, MG is different for every patient. That is why it's called the snowflake disease. This means we all have different treatment plans that are specific to each of our needs. For me, I started with just mestinon, but when that wasn't enough, I started on high dose of prednisone. And yes, the moon face was definitely apparent during that period. I then started on EMBRYONAL. I had my thymectomy in November 2014, and then I started monthly IVIG infusions at Sick Kids around the same time. When I transitioned from pediatrics to adult, there was the option to do subcutaneous IVIG. If you're not familiar with this method, it is all done in the comfort of your own home. And for me, I had 2 needles I poked myself into the subcutaneous fat to administer the immunoglobulin. I continue to do this now once a week, and it was the best option for me when I moved away to university, and I didn't have to travel to Toronto every month and miss a full day of school. I'm also currently on all 3 medications, but less prednisone. So the floor I was on for all my IVIGs was 4C at Sick Kids. Because I was there so often, the staff on the floor became like family. I knew all of the nurses, the receptionists, and I knew things about their families, like whose kids were applying to which university, what one nurse's daughter picked out for her dress at prom. Even though I'm not a patient anymore, I still go there every time I see my new neurologist and visit. Although I never wanted or saw myself being diagnosed with something like MG, this aspect of my care I really value and the connections that I have made along the way. So when I was first diagnosed, I didn't want anyone to know. I was embarrassed and I automatically assumed that people would either not be able to understand or wouldn't believe me. In grade 11 was the year I decided that I wanted to bring awareness to MG and help others like me. I'm not sure what exactly made me switch to be open and vulnerable, but I knew I was tired of hiding and I wanted to have something, a resource that I could direct people to, as I was tiring for trying to summarize my whole story, especially to people who overtly showed their judgment, like when I used the elevator and I looked completely normal. I was chosen by my school to do a TED Talk and I spoke about my diagnosis and my story up until that point. The initial goal was to bring awareness to MG and I wanted people to understand me. Little did I know that it was going to reach many people across the world. One girl in Germany I connected with told me my talk inspired her to share her story online for the first time, which I think is huge. My talk has also been shared within the medical community. My Sick Kids neurologist, as well as my current neurologist, both use it as a teaching tool to send to colleagues and to newly diagnosed patients. It was one of the most rewarding experiences, and if I ever had the opportunity again, I would take it in a heartbeat. And this was just the beginning of my public speaking and advocating journey. So as we all know, MG can present with some complications, and many of us experience what's called an MG crisis. A few months after my TED Talk on the last day of my exams, I was feeling exceptionally weak. I thought it was most likely because of the stress of the exams, so I went home and relaxed. Usually rest helps, and the next day I start to see improvements, but this time I continued to get weaker. It got to the point where one night I was FaceTiming a friend discussing an event we had upcoming to plan at school, and I couldn't keep my eyes open. It progressed later that night to difficulty breathing. My mom called 911 and paramedics came. They took my blood pressure and assessed my oxygen levels and said I was fine. Meanwhile, I was taking everything in me to get enough air and contract my diaphragm. The paramedic automatically assumed it was asthma, but my mom told him I had MG and she was afraid I was having a crisis. He wasn't concerned, but said if we felt better that he could take me to the hospital and get checked out. I'm so thankful for my mom being my advocate in those moments because I truly could not communicate. We got to the hospital, and once I told them I was a patient at Sick Kids, they got on the phone with an on-call neurologist at Sick Kids for further instructions. This picture in the middle was the first night. Little did I know that I was going to be in the hospital 11 days fighting for my life. I was transferred from the local hospital to Sick Kids because the hospital just simply was not equipped to treat me. This was the weakest I had ever felt. Nurses had to lift me off the bed and hold me to go to the bathroom. I was getting periods where it was so hot that I needed cold cloths on me, and then I would shiver where I needed heating packs. It got so bad that I went into septic shock and was transported to the ICU, where they inserted an NG tube and put me on a CPAP machine to help me breathe. I lost count of how many times they did blood work, and they poked and prodded so many times that they had to resort to taking blood from my feet. It turns out what triggered the crisis was mono, a disease that isn't too serious in the average person, almost killed me. And if I had listened to that paramedic and stayed home, who knows where I would be. I think it's really easy to feel some very negative emotions surrounding your diagnosis of MG, and a lot of grief over so many losses from your past life before MG became a part of it. I've learned how important it is to celebrate the small wins. Here are just a few examples of mine. At the beginning of high school, I fell on the steps of a school bus twice, which left me anxious and afraid of ever stepping onto a bus again. I spent 2 years in high school escaping taking a bus, which made me miss out on some things because of this fear. I had a full circle moment, however, in grade 11. The initial trip where I first fell on the steps was in grade 9, and we were headed to a grade 9 mixer. In grade 11, I was in the leadership program that was in charge of organizing and running the grade 9 mixers. I was determined, and I was able to get up onto the bus with no falls. The bus driver probably thought my mom was ridiculous for taking a picture of me on the bus, but it was a huge milestone and I conquered my fear. I also previously spoke about heavily I was involved in drama at my high school in the productions. In grade 11, we did Annie. We did multiple early morning shows for elementary schools, and we did multiple evening shows. One of the evening shows was the night of my TED Talk. One of the scenes I was sitting on a block and my role was a homeless person. I had such a busy and tiring day that my legs gave out and I couldn't get up off the block. And no matter how much people tried to help me, I was like dead weight. When the lights went off to change scenes, I ended up crawling off stage, fighting everything in me from crying. I was so hard on myself, and it was my drama teacher who made me realize all that I had accomplished that week and that day. I took a rest from one of the scenes, and then I went back out there to finish the rest of the show. The last example I want to highlight is I moved away to university. Something when I was first diagnosed I could only dream of. It was the first time I felt real independence, and even though at times it was difficult, I would not go back and change my decision. So, like most of us, MG is a constant struggle, and it can be a roller coaster in terms of fluctuating symptoms. Second year of university, I was thriving physically. I was off prednisone, and I was very active in volunteering, extracurriculars, and juggling so many challenging classes. But when third year started, something was off, and my MG progressively worsened that year. It was discouraging to have to go back on prednisone that I had worked so hard to get off of. When the pandemic hit, part of me was relieved that I didn't have to struggle living on my own, and I would have the support of my family at home. I started seeing a naturopathic doctor and changing my diet and lifestyle factors, which was helping. But also during the summer of 2020, I was struggling with my menstrual cycle and was dismissed multiple times. In November of 2020, I had intense pain during my menstrual cycle, and I did not stop bleeding for months. It was diagnosed as bacterial vaginosis. I completed 2 rounds of antibiotics, but the problem was still there. January 4th, 2021, I was in the most excruciating pain for over 10 hours straight, and no over-the-counter medication was helping. I was dismissed at the hospital, a triage nurse telling me to put my big girl pants on and get off the stretcher because other people were dying. I was curled over in pain, blood soaking through my double overnight pads through to my pants. Nobody seemed to understand MG, and I left the hospital scared. I went again by ambulance a second time later that night and finally got an ultrasound where they found 2 small masses, but I was told not to worry, that they were probably fibroids. I was scheduled for an MRI the next week, but I did not make it that long. In the short span of a week, the mass had grown so large it inverted my uterus. I had emergency surgery in January to correct the inversion, and a week after I had left the hospital, I was diagnosed with a rare form of cancer called uterine embryonal rhabdomyosarcoma. I was told there was only 20 documented cases of this type of cancer, and it was never seen in someone at my age, mostly younger children. In February 2021, I had a hysterectomy, and in March 2021, I found out that I needed 14 rounds of chemotherapy and 25 sessions of radiation. I pursued fertility treatment and underwent egg retrieval, and I had an oophoropexy, which is a procedure where they relocated my ovaries so they're out of the radiation field when I will have radiation on my pelvic area. All of these surgeries and trips back and forth to Toronto were very hard on me both mentally and physically. Countless times I had to advocate for myself and teach my new oncology team about myasthenia gravis, who openly admitted they didn't know anything about it. At the end of March, 4 days after my oophoropexy, I started chemotherapy. A week later on Easter Sunday, I was admitted to my local hospital for febrile neutropenia. In that same week, I lost my hair. My cancer journey thus far has not been easy, and chemotherapy especially has been really hard on my body compared to other patients. Balancing fatigue from MG and fatigue from chemotherapy is next to impossible, so I write everything down and continue to be vocal with my doctors about what I need and how MG impacts me and may be impacting my treatment. Every day I'm fighting for my life, and having such a complicated case is not easy, but I know I need to keep the faith and that I will be okay, and that this experience is making me stronger, like my journey with MG. So, like I said before, I want to highlight again the importance of self-advocacy. I have experienced the power of self-advocacy through both my MG and cancer journey. The picture on the left was taken in New York City, a trip we had planned to take before my crisis back in 2016. And even though my mom wanted to cancel it, I was determined to still go, and I got the approval from my neurologist. 2 weeks after being home from the hospital is when we went on the trip, and looking back, it probably wasn't the best decision I had made. I struggled a lot. We had purchased tickets to see Les Mis, which is my favorite musical, and that morning we weren't even sure if I'd be able to go because I was so weak. My mom ordered us a private car that would drop us off at the front door, and she made sure to get tickets on the ground floor because there was no elevators. At intermission, I had to go to the bathroom, and the regular washrooms were upstairs, but there was an accessible washroom on the main level. We were stopped by an usher who gave me such an incredibly hard time for using the accessible washroom. I was about to show her the letter from my neurologist that I keep with me, when a lady spoke up and advocated for me, saying that it was my right to use the washroom and I did not owe this usher anything. I continue to advocate for reasons like this and to educate people so that this hopefully doesn't happen to someone else. So I just want to preface that I do have a picture coming up of my tumor on this next slide. So if you think the picture may be too much, it is okay if you want to look away from the screen, and I'll let you know when the slide has changed. So this picture here on the right is my 7.5 centimeter tumor that was growing and flipped my uterus inside out. I was hesitant to go back to the hospital after the first horrible experience, but I persisted, and I was finally listened to after months of basically being told nothing was wrong. So I changed the slide for anyone who needed to look away, so you can look at the slides again. So while the whole focus of this presentation is positivity, I want to be as transparent with you all as I can. Sometimes it's really difficult to feel positive, especially when you're newly diagnosed or you miss out on something because of the limits of your symptoms. I'm here to tell you that it's okay to feel negative emotions, and I think it's necessary to. I would be lying if I told you that I'm happy, hopeful, and positive every moment of every day. You're allowed to feel grief, sadness, anger, confusion, fear. It's all about finding a balance between being positive, hopeful, and optimistic and feeling those negative emotions. The last thing you want to do is bottle all that up because you think you're supposed to be positive about a situation that sucks, for the lack of a better term. But it also is important that you do not stay in that negative mindset. And if you find you're staying in that mindset for long periods of time, I encourage you again to reach out and ask for help. Everyone needs it at some point. Whether you need to talk to a professional or you will need to vent your frustrations to a fellow MG warrior that gets it. There's also the idea of toxic positivity that I wanted to mention here as well. Sometimes you just need to feel sad, angry, or whatever emotion about a situation in order to process and move on. So I definitely encourage you to be open with people that you open up to if you feel that they're invalidating your emotions. Sometimes all you need is someone to say, yes, that really sucks, instead of hearing something like, well, it could be worse. Like I said, there is a balance. So another component I believe is very important to discuss is feeling like you have purpose. I know probably for many of us, MG has taken so much away and we can get into the mindset of that we have no purpose, or we keep asking the question, why? Why did this happen to me? I questioned this a lot when I was first diagnosed with MG, and to be honest, I still sometimes question it. It became apparent to me once I did my TED Talk and when I was diagnosed with a rare cancer that my purpose was to share my story, raise awareness, educate and advocate, and to be someone that people can relate to and help them, make them feel less alone in their struggles. I started to share my journey via Instagram, which progressed to TikTok, which then progressed to starting a YouTube channel documenting my cancer journey and educating people about MG as well. My first video on YouTube has over 12,000 views, and the response from people have been incredible, and it motivates me to keep going and sharing, even the raw emotions that a lot of people don't show. So like I mentioned at the beginning of my presentation, before I was diagnosed with cancer back in December, I was accepted into naturopathic medical school. I developed a passion for naturopathic medicine because of its holistic approach and the strategy of starting with finding the root cause of symptoms and using methods such as diet and lifestyle changes to help improve symptoms. My goal one day after I beat cancer and graduate is to start my own clinic with a focus on autoimmune diseases and oncology and help my patients thrive, with an emphasis on quality of life in partnership with MDs and the rest of the healthcare professionals on my future patients' teams. It takes a village, and I want to be a part of helping patients feel their best. So I want to leave you with a toolkit essentially of ways you can bring out more positivity if that is something you struggle with or you're currently struggling with. So for one, be open about your diagnosis, especially with close friends and family. I found when I became open with these people in my life, I no longer had fear and stress about doing activities or felt bad when I couldn't do something with them because I had the security that they understood. Another component which I mentioned in my story is to find alternative activities that bring you joy, with the modifications and adaptations to fit your specific needs. For me, I traded sports for drama and again was honest about my limitations, and the proper modifications were put in place. Developing a strong rapport with your healthcare providers I know is easier sometimes said than done, but it can make the world of a difference. They don't have to be your best friend, but advocating for your needs, no matter how many times you need to communicate those needs, will result in an overall better quality of life. Again, find your purpose, but don't put too much pressure or weight on it. Maybe MG has redirected your life and you can start that small business you always wanted to start, or maybe you want to work in the healthcare setting, or maybe you want to do something like I'm doing. No matter what it is, remember your life always has purpose. If you find yourself struggling because no one in your circle can relate, I encourage you to find someone around your age with MG. I remain connected with a few people my age, and it's been soothing to the soul over the years to be able to relate to someone so closely, especially someone who is in the same phase of life you were in. Journaling has become a tool that has benefited my mental health. An exercise you can do if you're feeling negative about your situation is to write a list of the things that you've learned from having MG and how this has impacted your life and the person you are today. Your list may surprise you and may make you feel some gratitude for the lessons you learned. I know for me, having MG has made me a more compassionate person. I'm able to empathize with others, even if my struggles do not exactly mirror their struggles. Have discussions about MG with anyone who wants to listen and learn more about it. When I was making new friends in university, I took every opportunity I could to educate and tell people my story. It can be scary and uncomfortable at first, but when you do it, it can also feel empowering. And spreading awareness one person at a time is making a difference. And you can feel good knowing that you're making positive change. And lastly, remind yourself that your life does not end when you're diagnosed with MG. It is just changing direction. So much can be lost from this disease, but so much can be gained, even if in this moment you don't know what that gain is yet. And I will leave you with this. MG is not an easy battle. Know you have strength in just getting through each day, and there is purpose in your fight. Thank you so much for being here and allowing me the space to share my story with you all. If you have any questions, feel free to ask away. I am an open book.
Hi, Becky. Thanks so much for sharing your incredible story with us. We do have a couple questions. So the first one is, what do you say to other young people who are newly diagnosed or scared?
I would say to someone else that is young is that it can feel scary at the beginning because it's so new, everything's so new. And you're trying to find like the proper medications, the right balance of different treatment options. For me, it took quite a while to figure out, what concoction, for the lack of a better word, of medications and treatments work for me and help with my symptoms. So I would just encourage them to, just be patient with all that and know that it is going to be okay. And even though right now, you may be really struggling, that you will find that balance and that, you're exactly like I said, your life doesn't end because you were diagnosed with myasthenia gravis. It's just changing direction.
Beautiful way to look at it. This next question is, what do you do to be sure that the ER staff know you have MG in case you have to go without somebody who knows you, in case you go by yourself?
I'm glad that question was asked. So I keep with me a letter. So you can ask your neurologist actually to provide you with a letter, and my letter outlines what myasthenia gravis is, what a myasthenia gravis crisis is, and then also what I keep attached to that is a list of medications that I can't have having myasthenia gravis, and I give that to whoever, like the doctors, the nurses, like ask them to like copy it on my file or just give them the copy. So I would recommend having something like that, especially like if you can't communicate. Luckily, like when I had my crisis, like I had my mom with me, but I know with like the pandemic and everything, like I had to go by myself. So having like, something in writing, like saying this is what I have, and like having your neurologist like contact information if like those doctors in the ER need, further instructions, then I think that's a good thing to have.
That's great. Yeah, the MGFA also has emergency alert cards that we have. You can print them out on our website. They're made to be wallet size, and they kind of share a little bit of that information too, like that you can put in your info. The cautionary drug list is on there. So really just easy ways to try to have something on hand with you at all times. Okay, this next question is, have you been able to travel? And if so, what precautions do you take?
So I haven't done a lot of travel recently. I would say the most travel I've done, I haven't done any international travel, but the travel that I have done was when I went to New York City. I just made sure, like I said, to have that letter and all that kind of thing, and like have all that stuff sorted, but I never really had to travel with like my like IVIG stuff. Like that's probably the only thing that I would think. I guess like planning a trip, let's say, if like that's the question. If I plan a trip, like I make sure that I have those times to rest, and like I think it's really important to like know your body and know what times of the days essentially you feel your best. So for me, really early morning and like late at night is not really good for me. So like midday, if I'm going somewhere like on a trip, I will plan things midday, not something like super in the morning. And then also like not planning too many active things all in one day. I think you just kind of like have to, like I said, you have to get to know your own body, and like everyone's going to be different. So I know for me, like my worst symptoms are like my leg weakness and then also my like facial muscles. So planning according to, if I'm going to have like a bad day, like planning around that and finding like alternative activities to do if I can't do that one activity.
That's
And
great.
then also with one other thing too, with like hotels and everything, I know there's like some areas that like don't have elevators. We'll just like make sure that there are elevators. And then also when we were in New York, we actually had a situation where there was a fire alarm and we were on like the 20-something floor. And luckily, like we didn't have to go down, but now we kind of plan it around, we like book the hotel on like the first, like our room on the first floor if we can, to like avoid any of that situation.
Thanks, those are some great insights. This next question is, what advice do you give to loved ones who want to help?
I would say the biggest piece of advice, I think, is to just listen. I think for a lot of people, and like I find myself doing this too with like, you know, when somebody's like going through something, like you want to just fix it, but you can't fix it sometimes. And, you know, you're not going to really, you can't really understand MG unless you have it. Like you can like know the symptoms, know like kind of like how the person that you love is affected, but you can't really know exactly how that feels. So I just would say, just be there for that person, you know, be supportive, like just make sure that they feel like they're not, you know, sometimes you can feel like a burden, like if you can't do certain activities with your friends or your family or something like that, or just like make them feel comfortable and make them feel seen and heard and just like listen to them. And it doesn't have to, you don't have to like tell them, you don't have to like make the situation okay. You can just, you know, be there as a listening ear and say, yeah, that does suck.
Thanks for that. This next question is, does your university know about MG, and do you have special accommodations because of MG?
Yes, I'm glad you asked that question. So I actually, when I was looking for universities, my mom and I started visiting universities when I was in grade 10, which is that sophomore year in the States. Yeah. So I was looking at them because of that very reason. Like I wanted to find a school that wasn't too small that I didn't feel like I was having the university experience, but not a school that was so big, so overwhelming that, you know, I'd get lost in the crowd and it'd be way too big. So my university was very accommodating in the sense of I met with student accessibility. I still, you know, communicate with student accessibility, and they know about my MG, and we've put proper accommodations in place for me. So for example, some of my accommodations is I get extra time on exams. So when we were doing it in person, I would write my exams in the exam center rather than the classroom. So like if I got weak, I could take some breaks. And then also like they're picky here with like having like water and stuff with you, and like having like belongings with you when you're having an exam. But like obviously like I need to take my medication, so like that was like another thing. And then one of my others was every once in a while I could get like an extension, and I would just communicate that with the professor. And I never had a problem. All my professors were very accommodating, and whenever I first asked for an extension for something, you know, they didn't give me a hard time. But if they did, then I had my case manager from Student Accessibility Services that could back me up and say, no, like she has these accommodations. And I'm very open about my MG, but if you aren't open about, you know, having MG, they are very like, it's confidential information essentially. So you would be the one to be open to like your professor that it's myasthenia gravis, but they can't say, they just know that you're in student accessibility, if that makes sense.
Great. I'm glad that you were able to connect with a university that can make some of those accommodations for you. It's wonderful.
Yeah.
This is a comment that I just wanted to read out loud. It's congrats on acceptance to ND school. My neuro path has been a great ally in managing my MG. Thanks for all your advocacy work and a great talk.
Well, thank you. That's awesome. Yeah, I found some improvements too with like my naturopathic doctor. And I really liked it too because it was very like educating as well and like empowering in the sense of, you know, she taught you like different things that you could help, like different like things about nutrition and that kind of thing. So I'm really happy to hear that.
That's great. We've got one more question. It looks like, what helps you be so hopeful? You have an amazing outlook.
Well, thank you. I would just say, I guess that's kind of a hard question to answer, but I would say that I'm hopeful because I've had days where it has been like, obviously like every day is not going to be a great day and you know how MG fluctuates, but I feel like I've experienced those days of like feeling really good and, you know, feeling my best. And, you know, on those days when I don't feel good, like I do feel negative sometimes and I do feel sad and all of those kind of things. But like, I know that somewhere like there's, you know, there's going to be a better day. And then I think too, like when I was talking about like having a purpose, I think that has especially helped me through my cancer journey, like doing like this advocacy kind of thing and, you know, making YouTube videos and all that kind of thing, like feeling like I'm making a difference in somebody else's life. I don't know, I think that also contributes to keeping me motivated to keep going despite, you know, a lot of setbacks.
That's great. Thank you. And we've got one more comment that somebody shared, and they said, sharing your story experience is so empowering and inspiring for others. Thank you.
Thank you. That's so sweet.
And I want to say on behalf of the MGFA, thank you so much for your time, for taking the time to share your story with us all, and for shedding some light on positivity. This has been, like we said, a special presentation for June Awareness Month, and we're so grateful to have you here.
Well, thank you so much for having me. I feel honored that I was the speaker for June.
Thank you. Well, this concludes today's webinar. Thank you everyone for your questions and participation today. Thank you again, Becky, for this wonderful session. Please enjoy the rest of your day and be on the lookout for ways to get involved with the MGFA for June Awareness Month. Thank you.